And while we are talking about instruments, everyone is talking about instruments, but an equally important aspect is the sterilization that has to be very meticulous and perfect. Otherwise, the best of surgeries with the best of instruments all go flop. So sterilization basically is the killing of all microorganisms, including the spores. These two words, sterilization and autoclave, are very interchangeably used. So what we will say in our small nursing home or a medium nursing home would be autoclaves ka saman le aao or sterilized saman le aao. It's very interchangeably used. But basically autoclave is the machine or a device that is used to sterilize equipment in a high pressure saturated steam at more than 121 degrees. The multiplication of the microorganism, when it concerns the spores, the death of the spore occurs after 130 degrees. So high heat is mandatory to kill the spores in addition to the vegetative organism. Now, three parameters are they are interlinked with each other: the temperature, pressure, and the time. So, well, the normal steam at 0 atmosphere or 0 bar is at 100 degrees. As we increase the pressure, it requires more temperature to convert into steam, and that would decide how much pressure we need to keep. The minimum holding time increases from 3 minutes to 5 minutes as the temperature increases from 120 degrees to about 138 degrees. But if you want an efficiency in your sterilization system, you have to lower and limit the bioburden. You have to adequately prepare the devices, have the correct sterilization parameters, and maintain the sterility even after the sterilization procedure has been done. The methods of sterilization are mainly the heat system, which is dry or wet heat, or the chemical systems, which is low temperature plasma or ethylene dioxide. I'll skip over this slide, but the heat methods basically are two: coagulation. So if you put an egg at 52 degrees, you see a hard-boiled egg, that's coagulation. As opposed to that, if you fry an egg, after the coagulation has taken place, the burning that occurs at the site is oxidation. And it is the oxidation of the microorganism that is mandatory to kill the spores. So three common methods of heat include the open flame, the dry heat, and steam under pressure. So this was very commonly used previously, where in a kidney tray would put some spirit, put a flame to it, and temporarily heat the instrument. So that was done. But if we see the dry heat, it is used for items that can withstand a lot of heat. Say like stainless steel, some types of glasses, they can withstand heat. So dry heat is helpful in such situations. And these items are usually wrapped in aluminum foil or something, and adequate temperature is achieved. Wet sterilization. Now, wet sterilization, it is steam that is used in this situation. And the steam does two things. One is it fills in the narrow cavity. Say there is a reamer, and the shaft of the reamer inside the cannulated part will be filled by the steam, and the other part will be to kill the bacteria at adequate temperatures and for adequate time. Now, vapors and liquids, basically we are talking about the formaldehyde tablets that were used, the formalin solutions that were used previously are less commonly used now, because if you are using a liquid, after the sterilization process, you have to rinse off the liquid before using it inside the body. So it is a lot of inconvenience and impractical. The ETO sterilization is very popular, but the problem is that It is explosive, carcinogenic, and requires extra safety precautions. But the benefit is it is extremely cheap. So I would say a cartridge even today would cost about 80 rupees for a small size cartridge. Now when we talk of radiation, we are very used to listening to gamma ray irradiation. The benefit is that you can cover very high volumes of it. So that is extremely good. The X-ray radiation is really not very effective and so is not used. The newer techniques of sterilization include flash sterilization, plasma sterilization, and of course ETO. The flash sterilization, the word is so attractive that everyone just says flash karo, usko flash karo. But always remember that there are no shortcuts in a flash contamination, sterilization. The first thing is one has to decontaminate properly. All the sides of the equipment should be exposed to the steam. Get your parameters right. Put your indicators. Confirm your parameter settings. After you have removed the equipment from the flash, you should look at the indicator that the sterilization has taken place. And this should be documented. Whenever you use a flash, document that you have used a flash. In case of a problem, you can always go back and rectify your steps for the next future. Now, it should not be used for the reason of convenience. It is just one of those abhi gira or abhi chahiye wali situation. Ideally, it should not be used for implants. Although it is used, but ideally it should not be used for implants. It may be used for the instruments. Only if it is unavoidable, then the implants may be flashed. And especially when there is very inadequate time, that's the time when we go for it. Plasma sterilization, what is plasma? Plasma is basically a quasi-neutral collection of positive ions, neutrons, etc. And they work by ionizing radiation. Now this ionizing radiation, when it comes in contact with the molecules of the cell wall, and everything vaporizes and disappears. The problem of the plasma sterilization is it has a weak penetrating power if the bioburden is high, and if there is a complex geometry, like there's something circular, then the plasma sterilization is not very effective. Some types that someone may ask you what cycle autoclave you are going to buy. So there are 3-4 cycles. There is a class B, N, and S. The N is the non-wrapped instrument. The S is what is specified by the manufacturer, and B is the usual, the big sterilizer that we use. So if you have a B category of sterilization, probably it covers all our requirement. One of the more common misunderstandings about sterilization is that machine. It's that machine ki yahan se jayega, wahan se niklega, ye size, ye pressure, ye temperature. But I think probably the mindset that needs to be changed is sterilization is much more than this. It's just like an Indian marriage. Aap bolo shadi 7 pher hai? I don't think so. वो शुरू होता है, वो पहला मेहंदी होता है, वो कंकोत्री लिखता है, वो क्या इनविटेशन कार्ड सबको देने जाते हैं. शादी इज अ लॉट ऑफ थिंग्स. उसके बाद में वो गरबा नाच होता है गुजरात में हमारे यहाँ पे, शादी फिर विदाई, एंड सो दैट होल थिंग, ऑल्दो एवरीवन थिंक्स ऑफ इट इन जस्ट that 7 phera. So pre-rinsing, disinfection, segregation of the instruments should come in next. Then the ultrasound machine and the water disinfection. This has to be properly dried. You can't put wet instruments into this thing. It goes into an assembly area. From there, after the autoclave, it goes into the sterile room. And equally important is the transfer from the sterile room to the operation theater. So nowhere in between you get into a problem of de-sterilizing. So a few video clips by the permission of the chair. So these are instruments that have just come out of the operation theater after surgery, and this is a pre-rinse. So it's just a rinsing. And you will see that this is done, and then there is a jet, and this jet again is switched on, and that has been rinsed. Now, from when you get inside, you have got your disinfection process. So this is a container. The middle picture shows that the whole tray goes into the container. This tray has been taken out. This disinfectant container contains either detergents, enzymatic cleaners, etc. Then instruments are separated. Now this separation, just one second. Now, after the separation, that is, artery forceps are separated from forceps, from the needle holders, and this is a decontamination room. You saw that the mops for every area is different. You will look at this. Every instrument is opened and kept so that proper cleaning of the instruments can take place. Now, there is an air gun there, and then there is a water gun, and cleaning with both air and water, specially cannulated things is being done. Then you have your ultrasound machine, and finally your, of course, then decontamination again if required, and that's your water disinfection. So this is a machine that is pushing it, it's just like a washing machine, which is pushing in the water. The mops for the sterile room from the assembly area, every mop is different. So a dirty mop doesn't go into a clean area. And this is your linen room. On your right hand side, you can see two pictures. A new towel, so this is a illuminator on which the towel is kept to look for the torn or the old, that is to be discarded linen. Assembly room, here the assembly of the linen with the instruments takes place, and finally you have got your storage. Everywhere you have got two door systems so that you don't make any mistake on that, and that's your sterilization that has taken place. And you will see there is HEPA filter also in the storage area. Do not forget your indicators. So you have got BOVIDIC. So you put this one, you have to put inside the sheets or inside a drum. The other is outside in the autoclave area. You have got chemical and biological indicators also. A change of color will tell you that the autoclaving is. As surgeons, it is our duty that when we scrub, we should ask for the indicator. मैंने ड्रम जो मेरे ड्रम से जो ट्रॉली बनी उसका इंडिकेटर मेरे को दिखा दो बस. So that you have, that keeps all the staff on their toes. And this all should be documented properly. Documentation, because if tomorrow for any medical legal reasons you go to the court, you should be able to show even a 5-year back done surgery. Now these are our background heroes. They have to be given adequate importance. So it's a very depressing job sitting behind. And the World CSSD Day is the 10th of April, coming next month. And so to summarize, basically, remember that between 120 and 134 degrees, depending on the temperature, the adequate time should be used. Steam is the most common method. And flash sterilization should only be done for the instruments, not for the implants. There has to be a dedicated team. वो ऐसा नहीं कि कोई देख नहीं रहा है तो कुछ आगे पीछे करे. That should not be allowed. Protocol should be followed, and documentation is important. Thank you.